Pterygium is a raised, pinkish, wing-shaped fleshy growth on the conjunctiva of the eye extending towards the cornea. 90% of the cases occur on the nasal side. Essentially, it consists of three identifiable parts: an apex or head, a neck, and a body, with the head extending towards the cornea and the base towards the inner part of the eye. Surfers who spend a prolonged period of time in direct sunlight and reflections from the water are susceptible to pterygium. Hence, pterygium is often known as surfer's eye. Causes. Pterygium has no definitive cause, but following are the contributing risk factors. UV rays. UV rays can cause inflammation in the conjunctiva, oxidative stress, and even loss of limbal stem cells, resulting in pterygiums. Pterygium is more commonly seen in people living in hot, dry environment. It is more likely to develop in people who spend more time outdoors, such as farmers, surfers, fishermen, and alike. Genetics. The formation and persistence of pterygium are fundamentally dependent on hereditary susceptibility. Symptoms of pterygium. In most cases, pterygium is asymptomatic, but it can sometimes lead to discomfort that needs medical attention. Redness, burning, irritation, watering, an unclear vision if encroaching on the cornea, and the feeling of something stuck inside the eye are common symptoms of an inflamed pterygium. Is pterygium cancerous? Many people with pterygium worry that it is cancerous, but in reality, it is a non-cancerous, fibrovascular growth, appearing on the white part of the eye and growing towards the cornea. But sometimes an eye cancer called OSSN can look like pterygium. Therefore, a visit to an eye doctor for evaluation and testing is always a good idea. Diagnosis. The diagnosis of pterygium is clinically made using a slit lamp examination in the doctor's office. Eye drops for pterygium removal. A pterygium can only be removed surgically and there are no eye drops available to do so. Pterygium is usually asymptomatic but sometimes can cause redness, irritation, watering, and foreign body sensation, in which case a doctor can prescribe some anti-inflammatory eye drops, along with lubricating eye drops. What are the indications for surgery? Surgery is usually not needed when pterygiums are asymptomatic and do not cause much discomfort. Pterygiums, however, can be surgically removed in the following cases: pterygium covering or threatening the visual axis. Corneal curvature problems causing astigmatism. If the pterygium is over 3 mm, it may cause some astigmatism, and if it extends beyond the middle of the pupil in a typical cornea, it may cause greater than 1 diopter astigmatism, leading to distortion of vision. Other indications of surgery include restrictions in eye movement, documented progression by a doctor or by the patient, or symptoms of repeated redness, watering, and irritation. Most patients have their pterygium surgically removed due to cosmesis. What is pterygium surgery? A common technique used today is simple excision of the pterygium and covering the exposed area with a graft using glue or sutures. The grafts are either conjunctival autograft, limbal autograft, or amniotic membrane graft. The main problem within 12 months of surgery is a recurrence, which can be prevented with antifibrotic drops or beta irradiation on the eye surface. Whenever there is a significant pterygium coexisting with cataract and the patient requires cataract surgery, it is usually recommended to have pterygium surgery first. It may take up to 3 months for the eye curvature to stabilize after pterygium excision, and then the measurements are taken to calculate the artificial lens power for cataract surgery. Prevention is better than cure. Protecting your eyes from ultraviolet rays, dust, wind and allergies is very important to prevent pterygium. Protect your eyes from the sun by wearing UV protective sunglasses. Wide-brimmed hats provide additional protection for your eyes. Use lubricating eye drops to wash off any inflammatory mediators from dust, wind and sun that can cause pterygium. Taking proper care of your eyes and protecting yourself from UV rays are crucial. Don't neglect your eyes. For more information on eyes, subscribe to our channel.